Welcome to ThinkTech on OC16, Hawaii's weekly newscast on things that matter to tech and to Hawaii. I'm Jay Fidell.
And I'm Donna Blanchard.
In our show this time, we'll cover the Ebola response symposium at the John A. Burns School of Medicine.
JABSM assembled a panel of Hawaii's top experts in infectious disease to discuss the Ebola crisis in West Africa.
These are Hawaii's top health officials and experts in tropical medicine and infectious disease.
Ebola continues to spread in West Africa and into Europe. At the same time, a number of cases have been removed to the U.S. for treatment. Unless it is contained, it could be the most far-flung and lethal epidemic in modern times.
Hawaii is at the crossroads of the Pacific. By virtue of our geography and the size and breadth of our hospitality industry, we have visitors from all over the world. This makes us openly vulnerable to infectious diseases, and these days, particularly Ebola, which has a 21-day incubation period. Within that period, a person could come to Hawaii from anywhere in the world and not show symptoms.
The symposium was conducted at the medical school on Monday, November 24th, and ThinkTech attended. Here are some clips of the remarks made by the participants.
The panel is really the best panel that you could possibly have to explain preparedness for Ebola in the state of Hawaii, and I'm really grateful for them coming. The State Health Director, Linda Rosen, the State Department of Health Epidemiologist, Sarah Park, the State Senate Health Chair, Dr. Josh Green. We have the Centers for Disease Control, Medical Quarantine Officer, Tai-Ho Chen, Dr. Tai-Ho Chen, recently from Liberia. Okay? We were just asking him if he had been here for 20 months. Oh, he's been here for a couple of months actually back, but we want to make sure, I guess. And a very special guest from the Asia Pacific Center for Security Studies, an old friend of mine, Dr. James Campbell, is going to talk about global biosecurity. A great deal on Ebola preparedness has been done in this state. There are no Ebola cases in Hawaii. There haven't been any Ebola cases in Hawaii. And although we have a very busy international airport, a huge airport, and a lot of traffic, the Ebola epidemic is in West Africa, half a world away. It's really unlikely that we're going to have an Ebola case here. Having said that, many stakeholders here in Hawaii have worked together to ensure that we're prepared. And we really have to be prepared. And if that's not enough, take a look at this. Okay, so this is a recent download from the CDC by way of the World Health Organization Situation Report. Okay, this is an exponential growth of, this is a growing epidemic. We have plenty of reason to be prepared, and be prepared better than anything that we have been before.
We approached this issue as though we will have a case in the future, and with that approach in mind, we're able to mobilize individuals, we're able to, in fact I should say, over-mobilize individuals and attention. And I think a lot of us may speak to that today, but what's the benefit of that? Well, the benefit of being very prepared for what is a tragic disease is you see 40 or 50% of those poor individuals do die, you see on those charts. By being over-prepared, we're able to not only do what we can to make sure everyone in the state of Hawaii is safe, and all of the visitors that we have, which are many millions of people every year, are safe, but we're also able to prepare for what are the inevitable outbreaks in the future. There will be pandemics in the future that are influenza, infections that are spread through the air, very unlike Ebola virus, which is only through fluids. If we had a handful of cases of Ebola, if we did in the state of Hawaii, first it would be tragic because though 50% of the people wouldn't die in our country, maybe more like 20 to 30% might pass away from the infection because we have much better facilities to care for individuals in the United States. It would cause quite a calamitous effect on our economy. And a calamitous effect on a small state's economy means that travelers wouldn't come here if we weren't prepared. The budget would be very challenging so that we would not be able to do the important public health initiatives, the transportation initiatives that keep us safe, so many different things in a state like ours that we depend on travelers for.
And the Department of Health really is prepared to investigate and manage a variety of infectious diseases, and I believe are well prepared for this particular one. Another advantage that we have is that we're actually a small state, and we have relationships with key partners that we need to work with to prepare for this disease. So all the hospitals and healthcare providers are working very closely with us, and of course they play a very important role, and they've really stepped up to the plate in terms of identifying workers who might be needed to care for patients, training them, making sure they have everything in place should we have a patient, and also our pre-hospital providers and first responders, and of course our partners at CDC Quarantine. We're a small state, and that means that we trust each other and we work together well, and we don't have some of the barriers, I think, that you might find in other states. There's a variety of things that we've done together, and I think that we are pretty well prepared. You can never be completely prepared. I've been very, very pleased that our hospitals have stepped forward. Those that are most capable have been willing to work with us in preparing to receive patients. I think that, as was mentioned, there is a lot of work going into this, but it won't be for naught even if we don't get a patient with Ebola virus disease, because this is what we call the new normal. And we really needed to step up our game in general in terms of emerging infectious disease, because it's not going to be the last scary disease that comes along. We need to communicate to the public what the true health risks are. And in this disease, we are very challenged by trying to communicate the science in the face of great fear. We can understand that fear, but we can't let that fear dictate how we proceed. And that's a big communication challenge. And another reason that I think we're well prepared, and I should not fail to mention it tonight, is that actually the media has worked closely with us to get our message out and to help calm fears, and that's something that I very much appreciate.
What is preparedness, essentially? You know, it's being ready to deal with anything and everything every day. It's what we do in public health, frankly, every day. And we're talking about Ebola, but frankly, my staff and I have been working on preparedness for anything since I've been here, and prior to that, my predecessor as well, Dr. Effler. We're responding every single day to an infectious disease. Foodborne diseases are bread and butter, essentially, of public health. We see these things every day. It's essentially making certain that our systems, that our people, whether you're working directly in public health, healthcare, or elsewhere, understand how to adapt to the situation, to be flexible enough so that you know, whatever the situation might be, we can adapt, we can respond.
In addition to the domestic work, of course, that CDC has been doing, we've also been responding to Ebola overseas in the affected West African countries, as well as in countries around that. And one of the pieces that sort of plays a key role in that, in terms of protecting the rest of the world, has been sort of developing a layered strategy to prevent the exportation of Ebola through travel. And I was part of a team that was in Liberia in August of this year, working with the Ministries of Health in Liberia at the same time that there were teams from CDC working to help support Ministries of Health in Guinea and Sierra Leone, and then later on in Nigeria. Now there are also teams in Mali. There was a team in Senegal, essentially helping them to strengthen the ability to conduct exit screening for suspected Ebola cases at international airports. And that's an initiative that continues to be strengthened day by day. CDC continues to provide on-site technical assistance in the most affected West African countries. In addition, CDC has worked closely with our federal partners as well as state health department partners in instituting entry screening into the United States at the 5 airports that traditionally saw the largest number of travelers from West Africa. And in coordination with Department of Homeland Security, now travelers that are coming from West Africa and coming from those affected West African countries and coming to the United States are now being channeled to those 5 airports where there is a domestic entry screening process. And so there are multiple points of screening, and I think one of the key points in terms of preparedness is the importance of being able to provide the support so that travelers coming back from West Africa can be educated about potential signs and symptoms to look for, so that they can know to check their temperatures twice daily, and that the health departments that will be helping to follow them and care for them subsequently as they sort of come through their 21-day observation period have information so that they can help provide support for those travelers as well.
It's sort of an all hazards type preparation. You don't just prepare for one disease, because as you prepare for any kind of infectious disease threat, you're preparing for all kinds, the basic steps and actions that you take. So whether it's Ebola or SARS, as she mentioned, or MERS, any of these diseases that we hear about, the types of preparations that her staff is doing makes the whole state and really the country prepared. But what I'd like to do is just step back for a moment, because in addition to the domestic preparedness, which is so important, there are in fact what I would describe as externalities. There's factors outside of it. This is a globalized world, and there's countries and policies outside of America that impact our ability to become prepared. The sort of mantra of public health is early detection, early response. So epidemic curves, like Dr. Miller was talking about, they take off and go exponential. Dr. Chen is very much interested in enhancements in the air transport surveillance. That's screening of people as they get on the airplane from, say, West Africa, and then as they get off the airplane in these 5 international ports of entry that he mentioned on the East Coast. This is extremely important, and in Asia, it isn't done as well. During the question and answer, you might want to ask Dr. Chen about how well the African countries are doing at exit screening. I'm not familiar with it myself, but I know in Asia, it's not done uniformly, because our center, the Asia Pacific Center for Security Studies, just completed a workshop in Manila 2 weeks ago on biosecurity in Southeast Asia, and we discussed ways to enhance biosecurity in the region, recommendations that we delivered to the World Health Organization. And I know in some of those countries, I won't name one in particular, but they don't have their act together basically in terms of exit screening. So people can actually get on the planes there without being screened. Now, hopefully when they come to one of our ports of entry, they will be screened. The other thing is that the U.S. Center for Disease Control, with which Dr. Chen works very closely with the international port of entries, the states, and even local health partners. I've just listed a couple of the services that they provide. There's a GeoSentinel network. It's a surveillance system that monitors travel-related illness. I know Dr. Green has had a travel illness clinic, so he knows a lot more about that than I. They have a software called BioMosaic, which helps with contact tracing. What do I mean by contact tracing? If someone has an infectious disease, for instance, Ebola or one of the other diseases, we of course want to watch that person and take care of them, but if they've been in contact with someone else, it's possible that person also is infected or exposed. And so contact tracing means going out and finding everybody who contacted everybody and contacted everybody. You can imagine how big that gets. And then the last, the CDC collaborates on investigation, notifying of disease threats. Okay. Now, we've been talking about Ebola. Ebola, as several of the professionals up here mentioned, is probably an unlikely threat in the state, much more on the East Coast. But it's not like we're disease-free out here. The flus, the various avian influenzas, the ones that constitute the seasonal vaccine that you get, where I hope that you've all gotten by now. We are in the flu season, after all. It's an avian flu. It's a disease transmitted from animals to man. And you've heard of the bird flu, H5N1, you've probably heard those terms. This is very challenging out in the region, because people in the region, Southeast Asia in particular, they live in very close association with their animals, and so there's a good chance that they can become exposed. The upper screen shows people sleeping in a chicken coop, so there's a good chance of exposure. Fortunately, in the case of the bird flu, it's very difficult to catch the disease from the chickens, and moreover, it's difficult to transmit it to other people. However, if you are unfortunate enough to actually contract H5N1, there's a very good chance you will die, because the case fatality rate is about 60% with that disease. The other disease mentioned in the bottom, the H1N1, the swine flu, there's actually a vaccine for that, and I believe that's in the current vaccine, so you can get vaccinated against the pandemic strain. It's sort of the reverse of bird flu. It's really easy to catch that and transmit it between people, but the lethality is much, much lower. And so we have a vaccine against the less lethal one. We don't have one against the other one, at least not yet. So the last point I want to make is that we've shifted in the World Health from a strategy of trying to control an outbreak as it passes across an international border, trying to catch it at the border and do something about it there, to trying to control it at the source.
What I noticed early on after the unfortunate events in Texas was its rapid response in the community of healthcare service delivery here in the state. Take the University Health Services on campus in Manoa. This is headed by Dr. Andrew Nichols, a terrific director there. And within a day, two things had happened. They had information from Dr. Sarah Park already, okay, which was detailed on what to do, and they had already thought of it at the same time themselves of what action they're going to take, and that was they're going to ask every patient that comes into that facility, and that is faculty and students from all over the place, okay? They even had a rabies case in Kyrgyzstan a couple of years ago. So, I mean, it's very heterogeneous. And they're going to ask them, where have you been in the last 21 days? It doesn't matter if you have a pimple or a broken toe, they're going to ask that. And if they say yes, then they're going to look at the symptoms and line that up according to the instructions that came out from the Department of Health due to the hard labor of these people here. And it affected everybody that I talked to, and they responded really in an amazing way. We have a terrific system here of medical care delivery, and a really responsive one that really picked it up. The thing that was also left out is that we have a stockpile of material, as it were, to deal with patients if we found one. You have to have a considerable amount of more material than you have just in your ordinary clinic, such as the special suits that you may have seen, the white suits that completely have an air filter system, completely protect the person. We have ample supply of that here, and we have people who are trained in using them. We have Dr. Rosen didn't show you this elaborate scheme that they have that you could see in the newspaper a week ago of the actual step-by-step things that happen when a patient is identified, okay? All of this was not dealt on in detail, but it's very important. And what I was a witness to, and of course as an epidemiologist, keen to know about myself, was just a really terrific response by all these different stakeholders, and it was so impressive. I said, you have to come here today and tell people about it.
Actually, it's comforting that the medical school organized this symposium and brought all these officials and experts together. We hope it bodes well for how we would respond in the case of a real outbreak. But keep in mind that an outbreak of any magnitude would shut down our tourism industry and thus our economy. And in that event, it would take more than medical expertise to recover what we will have lost.
A decade ago, medical researchers at JABSOM attempted to establish a regional biosafety lab at the medical school. This would have provided us with a facility and a base of local expertise and research with which we could protect ourselves from lethal infectious diseases like Ebola.
Dr. Dwayne Gubler was the principal investigator of that project. Although he had raised some $50 million of federal and state funding to build a laboratory, there were objections to the laboratory. People don't like having dangerous microbes around. And the University of Hawaii ultimately pulled the plug on the project.
The termination of the Regional Biosafety Lab was regrettable, not only for the loss of the science and the jobs, but the loss of a facility that could protect us in times of crisis.
It is all the more important that we recognize our vulnerability and take all the steps necessary to protect ourselves from infectious diseases that may come to our shores, including but certainly not limited to Ebola. That's the price of being a destination resort on the way to Asia and of accepting travelers from around the world. Given the consequences, it's a price we have to pay, whatever it is. And now let's take a look at our ThinkTech calendar of events going forward.
ThinkTech broadcasts its talk shows live on the internet from noon to 5 p.m. every weekday afternoon. If you missed a show or want to replay or share any show, they're all archived on YouTube.
Visit thinktechhawaii.com for our live stream and YouTube links, or to join our email list and get these links and program advisories on our upcoming shows.
We also invite you to be a part of our live audience at our downtown studio in Pioneer Plaza. Contact Jay at thinktechhawaii.com. Raise your awareness in every way on ThinkTech.
After the holidays, ThinkTech will resume its monthly lunch and panel programs on Thursday, January 22nd at the downtown Laniakea YWCA.
The panel that day will discuss the status of scientific research in Hawaii. It will feature a number of scientific researchers at the university who also mentor the kids in the State Science Fair this March. Our partner in the program is the Hawaii Academy of Science, the organizer of that fair.
Come join us and meet the scientists, the members of the Academy, and the kids they mentor. Be a part of science in Hawaii, at least for lunch. For further details and to sign up to attend the program, visit thinktechhawaii.com. And now, here's Donna with this week's ThinkTech commentary.
My name is Donna Blanchard, and this is a ThinkTech commentary. I'd like to talk about resolutions, New Year's or otherwise. I know, how dare I bring up the subject before Christmas, a time when we engage in the very behaviors we later resolve to eschew. Excess, greed, sloth, and gluttony. Gluttony. Peppermint fudge, anyone? USA.gov tells us that the most popular resolutions include lose weight, get fit, eat healthy food, quit smoking, drink less alcohol, get a better job, get a better education, save money, manage debt, manage stress, volunteer to help others, and recycle. That's 12 items, and it seems to me if I did 8 of those, the other 4 would pretty much fall into place. And I'll let you think about that one later. Other than recycle, the rest have been the most popular resolutions for decades at least. Over and over and over again, we resolve, but a study by Richard Wiseman from the University of Bristol showed that 88% of us fail, despite the fact that 52% of we resolving public feel confident of our success initially. That depresses me. I resolve to be less depressed by that statistic, though I'll probably fail. The ancient Babylonians made promises to their gods at the start of each year that they would return borrowed objects and pay their debts. In the medieval era, knights took the peacock vow at the end of the Christmas season each year to reaffirm their commitment to chivalry. I wonder what their success rate was. The U.S. Security Council's resolutions include a strong commitment to the sovereignty of Haiti and Somalia, rebuilding Liberia, and political settlement of the conflicts in the former Yugoslavia. I hope their success rate is better than ours. Richard Wiseman's study also found that men are more likely to achieve success when small measurable goals are defined, i.e. a pound a week rather than lose weight. And women do better when we make our goals public and garner support from friends, i.e. risking shame. But sustaining change is a problem. Statistically speaking, when dieters do lose weight, they gain back 107% of it. As Mark Twain said, I don't know why people say it's so hard to quit smoking. I've done it hundreds of times myself. Harvard School of Education professors Robert Keegan and Lisa Leahy think the problem is that we ignore the more complicated underlying reasons people behave the way they do. Most change involved in our resolutions is not behavioral. It's a matter of changing a mindset, and that's a matter of examining core beliefs and accepting that we have been operating under a belief system that isn't working for us, one that may be erroneous. And if there's anything more difficult than change, it's admitting that we have been wrong, right? Well, I'll leave you to Googling behavioral change before making those resolutions and considering the larger picture of Security Council's core beliefs. For now, happy holidays, everyone. Holidays. I'm Donna Blanchard, and this has been a ThinkTech commentary. We'll be right back to wrap up this week's edition of ThinkTech, but first, we want to thank our underwriters.
Okay, Donna, that wraps up this week's edition of ThinkTech. Remember, you can watch ThinkTech on OC16 several times every week. Can't get enough of it, just like Duke Oishi does. For additional times, check out oc16.tv.
Definitely, Jay. For lots more ThinkTech videos and for underwriting and sponsorship opportunities on ThinkTech on OC16, visit thinktechhawaii.com. Be a guest or volunteer, a producer or intern, and help us reach Hawaii.
Thanks so much for joining us on ThinkTech and for supporting tech, energy diversification, and globalism in Hawaii. You can watch this show throughout the week and tune in next Sunday evening for our next important weekly episode. I'm Jay Fidell.
I'm Donna Blanchard. Aloha, everyone.